Welcome. So today we are going to discuss about the topic MileuTherapy. So what do you mean by MileuTherapy? A scientific structuring of the environment in order to affect behavioral changes and to improve the psychological health and functioning of the individual, and this definition is given by Skinner. So scientific structuring means it will structure the what all the maladaptive behavior which the patient is having, and thereby the patient will be having a proper psychological health, and thereby the person will be functioning properly throughout his life. That is what is called as MileuTherapy. And this word MileuTherapy is a French word which means middle, and the English translation of the word is surrounding or the environment. Now, moving with the purposes of the MileuTherapy. So it will help to correct the redefine the perception of stresses. As I have told you in the definition, it will correct the maladaptive behavior. It will develop the adaptive coping, acquire interpersonal and stress management skills, manipulate the environment so that all the aspects of clients' hospital experiences are considered therapeutic. And the client is expected to learn adaptive coping, integrated relationship skills that can be generalized to other in his or her life and achieving a client autonomy. So mainly this is MileuTherapy. It is mainly used for the changing the maladaptive behavior which the patient is exhibiting. So the main principle is to promote a fundamental respect for individual, to use the opportunities for communication between client and staff for maximum therapeutic benefit, to encourage client to come at a level equal to their ability and enhance their self-esteem, to promote socialization, to provide the opportunities for client to be a part of unit management. The individuals are held responsible for their own action. So with the help of this MileuTherapy, it will be beneficial for both the staff and also for the client, and the patients will be able to enhance their self-esteem. A positive self-esteem can be attained like if they are taking part in the MileuTherapy. It will be helping to improve the socialization, to interact with the society, and it will help the client to have an opportunity for the active unit management, and he will be the responsible for person for his or her own action. And moving with the other principles, client is expected to learn adaptive coping, interaction and relationship skill that can be generalized to other aspects of his or her life, achieving client autonomy. Peer pressure is utilized to reinforce rules and regulations. Team approach is used. Group discussion and temporary seclusions are favored approaches for acting out behavior, and the nurse's function is to act in a way that consistently promote this goals. So the person will be able to attain a proper autonomy. Since it is a team approach, the interaction with among the other members, or his interaction ability with the society will be improved. And since it is a team approach, the group discussions will be improved, and the person will be able to achieve his goals. And moving with the characteristics of MileuTherapy, we are having 6 characteristics. First one is distribution of power, open communication, structured interaction, work-related activity, communication and family involvement in treatment, and adaptation of the environment to meet the developmental needs. So the all the work related activities, it will be distributed among the team members, and the persons will be having a open communication between these team members, and there will be structured interaction because all these activities will be controlled by one of the staff, and the activities which will be like given to the patient, it will be related to the work only, and there will family members will also be involved in this. So there will be a communication between the family members also, and the person will be able to have a proper adaptation to the environment in order to meet his developmental needs. So these are the characteristics. And moving with the components, the first component is maintaining a safe environment. Maintaining a safe environment means the environment should be free. It should be we have to be aware of the items which are harmful, like if it is ingested. For example, there is a chance of ingesting this mercury which is present in the sphygmomanometer, and we should not keep the medicines unattended or unlocked, or keep away the sharp instruments away from the patient. For example, mop handles, hammers, all can be available in the what. So all those things should be kept unavailable for the patient. That is the first one. That is maintaining safe environment. Now, second one is trust relationship. Trust relationship means one of the key feature in the therapeutic environment is in maintaining a or establishing a trust. So trust is the basic foundation of therapeutic relationship and limit settings and consistency. Because if there is no limit, the person will cross his limits. So first thing is trust the relationship, and next one is building self-esteem. So one of the key principle of this therapeutic relationship is building self-esteem. So for that we have to set and maintain the limits. We have to accept the client as a person. That is the first principle of mental health nursing. We have to accept the client as a person, and we should not be non-judgmental at all times, and we have to maintain a proper limits, structure the client's times and activities, and like we have to allow the patient to make his own decisions whenever it is possible, so that his decision making capacity will also be improved, and thereby his self-esteem will also be improved. And the next component is limit settings. That is, we have to state the expectation or limits closely, directly, and simply as possible. Means we have to say that if you are limiting this cross, like if you are limiting this settings, what all consequences he has to face because of this. All these things, it should be explained to him well in advance before starting the this therapeutic community. And next one is daily community meeting. Daily community meeting and staff reviews by the staffs for their patients, who all are have participated in that MileuTherapy. All these things should be discussed in this daily community meeting, and what all tasks they have to do on that particular day. That also should be explained to the patient, so that he will be able to act according to the timetable which is given by the staff. Now, moving with the advantages of MileuTherapy. So, it creates different type and attitude and behavior of client, because the environment like home, patient learn the making decision, like decision making, and improve his self-confidence. It develop a leadership skill. It becomes the socio-centric. It helps to learn the live and think collectively members of the community. All in all, the main advantage of MileuTherapy is the patient's ability to interact with the society, and ability to take decisions, and ability to improve his self-esteem. All those things will be attained with the help of this MileuTherapy. And the main disadvantages are role blurrings between staff and patient, because all the activities which is given to the which is allotted to the patient will be, some of the activities will be for the some of the activities will be of the staff's duty. So if the patient is taking the responsibility, there will be a role blurring between this. And MileuTherapy is limited to only hospitalized patient, requires continuous open communication among all staffs and client. Group responsibility can easily become nobody's responsibility, because we are not giving a particular assignment to a particular patient. We will be giving this particular assignment to a group of patients, and one or the other will be thinking that, oh, she will be doing or they will be doing. So likewise, it can become somebody's responsibility will become nobody's responsibility, and low client to staff ratio, because we can't maintain a 1:1 staff ratio. So what the other patients are doing, or what the other patients whether they are performing, or whether they are actively involving this community the setup, staffs won't be able to analyze. So these are the advantages and disadvantages. And what is the main role of nurse in MileuTherapy? So the nurse participate in the design or renovation of the settings, can greatly affect the therapeutic physical environment. The nurse responsible for making the referrals, encouraging clients participation. The coordinate all team member is involved in team. The nurse may interpret the need of all the clients, and the design expert with the knowledge of color. Means the nurse will be the person who is allocating specific duties to the specific group of patients. So if a nurse is not there, this activity won't be possible, and she has to participate in the design, and overall structure or overall the timetable should be there within the hands of the nurse, and she will be acting as a team member, and she will be the person, or he will be the person who will be who will be making all the other members in the team to work in order to bring a positive result. So that's about the topic MileuTherapy. I hope you all understood the topic. Thank you.